Welcome to the Darcy Wellness Series. During our series, we will present information on complementary and alternative medicine and how these natural, non-drug, non-surgical options can benefit your wellness and help keep your loved ones healthy. Today, we're going to talk about psychotherapy. Why is it so intrinsically holistic, and what is emotional health? Can psychotherapy help us process, heal troubling emotional states such as anxiety, depression, and grief? My name is Geoff Darcy, and I'm an acupuncturist and herbalist with the Darcy Wellness Clinic. And with me in the studio is Dr. Judy Dempewolff, psychotherapist, also practicing at the Darcy Wellness Clinic. Welcome, Judy.
Thanks.
So, what is psychotherapy?
Well, it's a lot of different things, but I would say it's primarily a relationship between a therapist who is a really good listener and a client who's coming for issues maybe around anxiety or depression or different things they're uncomfortable with. Right. So it's the relationship that is important.
Some of the most amazing things, like, looking over the information on psychotherapy, was that psychotherapy works just as well as psychiatry. And I find that fascinating.
Yeah.
Mainly because what we're about at the Darcy Wellness Clinic is presenting non-surgical, non-drug options to people.
Right.
But those medicines are really very powerful.
They are, and they have limited effect.
Yeah.
Quite often, a person might feel really good in the beginning of using medicine, and then the effects drop, so they have to increase the dose.
Yeah.
And when you increase the dose, the side effects increase as well.
Yeah.
So there are a lot of trade-offs.
So they're pretty frightening side effects. 2.1 million serious side effects due to appropriately prescribed pharmaceuticals each year. So it seems to me the idea of trying a natural psychotherapy rather than getting stuck into some heavy-duty pharmaceuticals would be an of course. So why don't more people try it before they would try the medication route, do you think?
It's a good question. I think a lot of people will go to their primary doctor first when they have symptoms, especially if they have a physical component, if they have anxiety and it's in their stomach, or they have migraines, or they're not sleeping.
So it's manifesting in their body more. It's not just something is a troubling emotional state. It's actually manifesting as migraine or sleep or something.
Absolutely.
So that takes them in to see their general practitioner.
Right.
And then very often they will automatically refer to psychotherapy, or will they refer to psychiatry?
Well, some primary doctors prescribe. They'll prescribe antidepressants or anti-anxiety and medicines, and they won't send a person to therapy. Sometimes they'll refer to a psychiatrist, but often psychiatrists mostly prescribe medication.
Yeah, so. And we know that a lot of these disorders are really growing every year. We were just looking at figures earlier. 12.3 million diagnoses of anxiety disorders.
And that was...
And growing. That was
98.
98,
yeah.
was it? Yeah. So the pressures building in society, time is growing shorter, and then the pressures to treat pharmaceutically. I mean, Prozac is a huge cure-all, pretty much.
Absolutely, supposedly.
Yeah.
But...
so it's not an either-or situation where, I mean, how many of your patients would be taking pharmaceuticals and seeing you? I mean, it's not either or, right?
No, it's not. I'd say about 30%.
About 30%.
Yeah. And some people come because they want to taper off their medication.
Yeah.
They want to have some support in doing that. Certainly working at Darcy Wellness Clinic, there are some non-medication solutions with acupuncture, yoga, herbal medicine that can help them balance, as well as working with techniques in psychotherapy like relaxation, meditation.
So you have a lot of options in your toolbox.
Absolutely.
What would it look like? What would you advise people who are finally thinking, well, maybe I should see a therapist? What would your advice be to them about shopping around?
That's a good question. I would initially say to a person, they are the customer.
Yeah.
So they should get a list of people on their health insurance, call, have a list of questions they want to have answered, so they can interview the therapist.
And the reason for that?
They want to get a feel for how the connection's going to be,
Yeah.
how the relationship's going to be, because when all is said and done, it's the relationship
Yeah.
that counts.
Yeah.
Studies have been done that show it really doesn't matter the type of therapy the therapist does,
Yeah.
or what their credentials are.
Right.
It's more the connection.
So the empathy is
Yeah.
the kind of... So you're not offended at all if somebody calls you up and interviews you, and it's very helpful to see if you have a good communication,
fit. Yeah.
good feel for each
Yeah.
other, so that you can work together. So that's really an important
Absolutely.
thing about the therapy.
Sometimes I'll tell a person to interview a few therapists, and if they want to do a little 20-minute trial with me
Yeah.
for free, they can do that, to just face-to-face sit and see
Yeah.
how it
Yeah.
feels.
Yeah.
Most people, no.
Makes a lot of sense.
Yeah.
Makes a lot of sense. So the idea that the therapy makes little difference. It's really about the therapist. Is the main point to shop around to see if you can
Right.
if you can connect.
Right. I mean, it does matter if a person's got training as a psychotherapist.
Yeah.
Social workers, psychologists are the most fully trained. And in studies that have been done, the Consumer Report study was the biggest study.
Yeah.
Thousands of people were interviewed. And social workers and psychologists tend to be about even.
Yeah.
Mental health counselors were a little less effective.
Yeah.
So, training.
And experience
helps.
in training. So how long have you been in practice?
35 years.
35
Yeah.
years. That's a lot of experience.
It's a lot of experience.
So you've gone through you have your PhD.
Yes.
Yeah.
Yeah. And
So you've seen a lot of changes in the field over 35 years.
yes, I have, especially with managed care.
Yeah.
Especially.
So the difference then between a short-term and more long-term therapy, the results are significantly different.
Yes, and long-term works a lot better.
Yeah.
On this age of managed care, it's a little more difficult.
Right.
But you can get more sessions. I can apply for more sessions, and
Yeah.
we'll get them
Yeah.
if a person needs them. And most people don't get better in 5 sessions. It
Yeah.
takes a while to establish a good working relationship with someone.
Yeah. So you have a lot of options in your toolbox. Over
Yes.
35 years, you've
Yep.
been helping people. And so tell us a little bit about what it looks like to come
Okay.
in, evaluation,
Okay.
so people can picture what the process is.
Okay, well, initially, I'll want to know what brought a person at this time. So I will find out why they chose this time to call and make an appointment. I'll ask the person about their history, if they felt this way before. So, for example, if they're depressed
Yeah.
and they've been depressed for a few months, I'll ask if they've had these periods before, what they see perhaps as a trigger, what...
So what are the common triggers that people...
loss.
A death of a
loss.
loved one.
A death,
loss.
a breakup of a
Yeah.
relationship, a loss of a job.
So a life crisis
Life
often
crisis, yeah.
precedes these events, and
Yeah.
taking that history is important to try
Absolutely.
to understand it.
Absolutely. And then, looking at their medical history, if they've had a recent physical, just to make sure
Yeah.
there are no medical complications, because there are illnesses like diabetes that have an emotional component.
Right,
and
chronic
it's-
pain would
Yeah,
be-
chronic pain is
Yeah,
another.
yeah, yeah.
So once I've got that history, then we can talk about what their feelings are, what their day is like,
Yeah.
what's the hardest part, what's the easiest part. I do a lot of listening in the beginning to really try to get a sense of what the person has gone through.
Right.
Sometimes I'll even ask about their eating habits and their caffeine intake and their alcohol use, and
Yeah.
find out exactly what
So those are all ways of
helps.
suppressing
Yeah,
emotional feelings.
absolutely.
Yeah, yeah.
Anything like overeating or drug use, alcohol use, even in excessive computer use, is a way of kind of covering over feelings, and to help a person see that and get underneath is really helpful. Then there are a lot of things that have been useful. Writing, journaling has been shown to be very helpful for people, not just this is how my day went, but this is how I feel, and these are some of the strong emotions that go through my day.
So what would you say to somebody who says, well, I am feeling depressed, but I really don't know what to talk about. You know, I don't want to see a therapist because I can't really talk about anything. Are there tools that you would use to draw out what's going on?
Certainly for somebody like that, writing can be very helpful.
Yeah.
Because they're doing it in the privacy of their own space, and they can explore themselves.
So kind of like homework, you would say to someone, okay, we need to get a bit further in your awareness of this.
Right.
You know, do this every day, just write about these issues, and then that can become fodder for the therapy session.
Absolutely.
Yeah.
Another thing I will sometimes use is stress reduction relaxation.
Yeah.
You have a great CD that I often use for all my clients.
Right.
And they take it home and they just go through 15, 20 minutes of relaxation every day that can really help with anxiety.
Yeah.
Can help with OCD.
Yeah.
Because if someone has OCD, their mind is racing. I talk about it as getting on the train. You don't want to get on that train of obsession.
Right.
So going through that relaxation can be really useful.
Yeah, good. Let's put up our first slide of the day, which I think is not a graphic of Judy doing some therapy, but a little clip art, what graphic. It might look like. So, Judy,
I don't have a desk in the middle. I don't like that.
Little barrier between the two. So, the idea of a biochemical imbalance. Now, oftentimes people receive a diagnosis and they say, "Well, it's my chemicals."
Right.
That are out of balance, and all I really need to do is take a pill that replaces or balances those chemicals. There's no real need to handle any underlying issues that are going on, and those issues can sit and fester in the unconscious, and nothing really gets achieved but some sort of masking
and a
of the
little
situation.
Feeling better, but not totally. Biochemistry is interesting. And a lot of people will say, well, it's just my chemistry. But we know that even sitting and talking with a therapist can change one's biochemistry. Serotonin gets raised when somebody is in psychotherapy. Everybody...
So they track that through a number of different sessions.
And saw that it works just as well as therapy with medicine. Therapy without medicine works just as well. So the idea of laughing is shifting the biochemistry of the body. Running, we all know, you know, the endorphins change when you do aerobic exercise.
So that explains why you have all those tools, kind of natural tools in your toolbox. The idea of relaxation, of herbal medicine, of acupuncture, meditation especially. You do.
I do.
I've a lot of meditation.
Incorporating that a lot more in the therapy of having a person do 15 minutes, 20 minutes a day. I have a client now who's very anxious. And her anxiety is always about the future. So she's not here. She's in the future. So the meditation can help her just notice when her mind is heading off into the future, can bring her back to the present, relax her body.
And gives it some, instead of running a story that would create the bad chemicals, that you would run a story creating positive endorphins.
Or just stay with, here I am sitting in the chair, feeling okay. You know, when she gets right back to now, it's not so bad. The same with someone with OCD. The minute they stop.
So obsessive-compulsive disorder, people compulsively washing hands or other behaviors.
Or they're thinking
drives themselves mad and their family around them.
Absolutely. So a lot of these tools can be really helpful in calming a person down. Also making them feel as though they have some control over the symptoms.
So the idea of of psychological armoring around these issues. Can you talk a little bit about that? About does meditation help to kind of relax or drop some of those guarded guarded feelings?
I think it helps a person not be so scared of the feelings they contact. Because with meditation, you can notice whatever feelings are there and then go back to the breath.
Yeah.
And it's not going to overwhelm the person.
Right.
And
so oftentimes if they think about a past event that would have some trauma, it would set off chemical reactions in the body, energetic reactions in the body that would prevent you doing some good work to bring awareness to that issue.
Right.
So getting them to do relaxation, getting them to do journaling, are those tools to help relax some of that?
It's a balance.
Yeah.
It's a balance of finding some of the roots and maybe re-experiencing them to a point, but then also having the present moment and the safety of the therapy itself to hold that trauma or that pain. So it's a balancing of the two always.
Yeah. Maybe we could go to our other slide and see. So this is about that psychotherapy is a range of techniques.
It is.
Based on dialogue.
Based on
communication.
Dialogue. One other thing I might mention is I will often have the person be more aware of their body.
Yeah.
So if somebody says they feel anxious, I'll ask them, well, where do you feel it in your body?
Yeah.
If they say it's in my stomach, I might ask, well, what's it like? Well, it's like a tight knot of rope. Then I can actually use that image and have the person go to the knot and work with the knot.
So they have something concrete to work with in visualization.
Yeah.
And again, the idea of visualization, producing change.
Right.
It's not just some sort of mental exercise that they can do.
No, it's more than that because they're connecting the image with their body and it really actually overlaps.
Producing a localized relaxation response. Yeah. So the idea of dialogue and communication, but it's just not about going and talking. You also want to see results in people's lives. So the idea that awareness and dialogue and that communication, creating changes in behavior.
Absolutely.
And actually, concrete changes in someone's life.
Mm-hmm. Yeah. Mm-hmm. So sometimes homework will be very practical. Like, I want you to make sure you get out and walk a half hour a day.
Yeah.
Or, your goal this week is to talk to your mother and let's write out what you're actually going to say.
Yeah. So the idea of actually setting homework to shift relationships, to open up dialogue in someone's lives, to begin work on neglected areas.
Yes. Yeah.
So that's producing concrete changes that kind of reverberate out into their relationships from their behavior shift.
And then they're going to feel differently.
Yeah.
They're going to feel more self-confident. When they start doing things they weren't doing in the past, it's going to help them gain some security in themselves and be empowered to do more.
Yeah. So do you find that most people that come to you, I mean, you've got really a vast experience of it, most people that come to you, are they trapped in these behaviors, kind of going around in a catch-22 kind of cycle, or are they?
Sometimes. Some people might come because a panic situation comes up, like they have panic attacks.
And most people don't realize that they can be completely overwhelmed, right? A panic attack is not something that's just imagined and is psychosomatic, is only in the mind. It will really shift the body, will rapid heart rate, cause fainting.
They're afraid they're going to die when they're in the middle of it. So helping people to see maybe what the trigger was is number one. And then finding ways to, for example, I have a client who had a lot of trouble with elevators, and she had a lot of anxiety over that. So to teach her to relax and then to set small goals of go up one floor, get off, go down one floor, get off, and then to keep it, make it more and more challenging feeling relaxed at the same time.
So the idea of seeing a therapist too, I mean, you know, people would say that, you know, in older times, that kind of empathy and dialogue would be shown by other villagers or other family members. But in this day and age, I mean, really, the difference between trying to get your therapy out of a friend
people get tired of listening.
It's right, pretty fast. So the idea of trying to get a therapist, I can just, you know, talk with my brother or my sister. I could see a friend and have a good chat. It's helpful, but it's not really progressively moving through issues as it would be if they sat down with you at the Darcy Wellness Clinic. The idea of sitting down every week and methodically working through issue has a great deal of value, I imagine.
Does. And what I love about being at Darcy is there are other options that complement what I do. So I could send a person to a yoga class, which would help them relax their body, or for a massage, or for acupuncture to help balance the energy.
So often we'll work on patients together. I'll refer to you, or you'll refer to me.
It's very nice.
It's a great combination, I must admit.
It is.
I must admit, because especially when acupuncture is kind of working with relaxing a lot of that physical and that kind of psychological armoring. You know, emotional issues are more easily to come up to the mind. Meet a balanced mind and be able to be worked with in a methodical fashion. That's right, with the psychotherapy. So the idea of seeing somebody and methodically working through the issue, and that nearly all of the forms of psychotherapy are kind of spoken. Are they not more conversational, more interaction?
There are some more body-oriented.
Use artwork
sometimes
in your toolbox too?
Absolutely, sometimes. I will occasionally see teenagers, and often will approach them more in terms of creative expression, especially if they're a little shut down. So artwork can work very well for adolescents.
Maybe we could go to another one of our infamous slides here. Here we go. So what is psychotherapy? There's the Consumer Reports, and that's 22,000 readers.
A lot.
It's really, you know, it does work, that long-term works, that there's no difference between therapy alone and medication.
I love that
really an astounding figure. You know.
And you know, managed care.
Why wouldn't you try it first before you had to go on to Prozac for the rest of your life?
Managed care will often ask me if a person is on medication early on, and I will usually say no. I mean, sometimes I do see people who are on medication, but managed care wants the quick solution quite often, which is not always
because it's
the
more
best.
Financially driven than therapeutically driven. They're trying to make the care much shorter term. So how many people actually pay out of pocket for, you know, versus, you know, because they can use insurance with you if they're accepted, right?
I would say maybe 5%.
5%? That's not many.
No, it's not. You know, I figure people have health insurance. They're often paying for it. They should be able to use it for mental health because that's going to affect their physical health.
It's huge.
It's huge.
And the ideas of trying to understand their feelings and understand new ways of being, that's a huge area of growth.
It is.
So oftentimes you can feel like you're doing the same old, trapped in the same old kind of behaviors. So that when people really start to move, it can make a big difference.
Absolutely.
And that must be very rewarding.
Oh, it is.
For you.
It is, definitely. And clients will come back and say, you know, you said something to me 2 months ago that really stayed with me, and I go, oh, good. Sometimes I won't remember what it was, but it obviously made an impact.
What are the average kind of length of a therapy session? I mean, what do you find that you work with people?
A session
over what period?
Is usually about 50 minutes.
50 minutes,
Usually people come to see me for maybe 4 months, sometimes longer. It depends on how long their problem has been going on. But usually people report quite a bit of improvement by the end of that time. I also work with couples, and that's a little different.
Actually, let's talk. We got our last slide. So the idea of group therapy being effective, of couples therapy. You work a lot in that.
With couples, I do. And couples therapy is a little different because you're not trying to get at individual issues,
Right.
but more at how the couple relates together.
Yeah.
Listening skills, which is always a big one with
Yeah.
couples in trouble. How to pay attention to one another and not jump in and
Right.
be defensive
Right.
and escalate the fight is
Yeah.
another one.
I've been known to make a few of those mistakes myself.
We all have.
So the idea of therapy making concrete changes, there was this study on breast cancer that
Yeah.
it first started out, this idea of psychoneuroimmunology, where you make a shift in
Yeah.
the way you think of the world, and it produces a shift in your
Yeah,
body.
yeah.
And the idea of they had two groups, right?
Right.
In this study with breast cancer, and one group who the only intervention they made, and I believe he was trying to disprove it at the time,
Yes.
that any intervention would make any difference. They had one group who did psychotherapy, or actually not even managed psychotherapy. It was just a group that got together,
support.
supporting each other through breast cancer, and they studied them, and they found that the mortality outcomes were less in the group that got together and had a
Right.
weekly support and laughed and cried
Right,
about
and
all the
shared.
and shared their feelings and not bottled them up. And that improved their immune system
Yeah.
to a degree where they actually live longer than
Yes.
the group that didn't. That's pretty
Yeah.
dramatic stuff.
It is, and I see it not just with that, but with people with eating disorders.
Yeah.
Certainly AA is built on
Yeah,
that.
yeah,
I mean,
yeah.
there's something about the group support and energy
Huge.
and sort of unconditional
Yeah,
caring.
the idea of the empathy coming
Yeah.
out again. I remember also in the Glasgow heart study. Glasgow has the worst heart health in in Europe, and they did an intervention, and their only intervention was that they got together with somebody and they worked on relaxation once a week, and they found that the outcomes of the triple bypass, those who needed triple bypass surgery, were much less in the group that
Interesting.
did the regular relaxation.
Yeah.
So, Judy, thanks very much for coming
Sure.
on. It's been a pleasure as always. And
Good.
thank you very much for joining us today for the Darcy Wellness Series. We hope that you've learned some non-surgical, non-drug options that are out there as part of complementary and alternative medicine. And from myself, Geoff Darcy, and Dr. Judy Dempewolff, a psychotherapist at the Darcy Wellness Centre, we thank you for joining us, and we wish you and your loved ones health and wellness.